Hello, my name is Michaela Fry. Here's my badge. This is my medication administration checkoff video for NU 311. I'm in section 116. My section leader is Dr. Swansea, and my section was assigned heparin. So next thing I'm going to do is just scan my area. So here's my patient, my goggles and stuff, the MAR and the order form, all of my supplies. The pen, all of that, my sharps container. Okay, so there's nothing over there, nothing over here. That's my study area, disregard that. Okay, so now I will begin my video. Okay, so first I would start off by just comparing the MAR and the order form. So I'm going to look for the right patient. So Jaguar J. Jones, MR is 4176352, MR is 4176352, allergic to penicillin, okay? So since my section was assigned heparin, that's the order I'm going to be looking for. So I have heparin, 5,000 units, subcutaneously, every 12 hours, and the patient has not received it in the last 12 hours. This is a high-risk medication, so I'd get a nurse to double-check everything behind me. So I know that the patient was admitted for a motor vehicle accident with a closed head injury. So that's what heparin is used for, to prevent clot formation. And all elements of a legal prescription are present. So I am done with the order form. So I can place that to the side. Okay. So the next thing that I'm going to do is I'm just gonna apply some hand sanitizer. Okay, cute. Okay, so now I'm just gonna show you my medication. So this is heparin, 10,000 units per milliliter. Expiration is 12/5/2025. Okay, so this is where I begin my first check of the 7 rights of medication administration. So I'm going to set this down right here. Okay, so Jaguar J. Jones, okay, MR is 4176352, okay, allergic to penicillin. All right, so I have heparin, 5,000 units. This is 10,000 units per milliliter, so I would draw up 5,000 units per 0.5 milliliters. Okay, it's given subcutaneously every 12 hours. The patient has not had it in the last 12 hours, okay. So this medication is high risk, so I get another nurse to double check everything behind me. And the patient was in a motor vehicle accident with a closed head injury, so heparin is given to prevent clot formation, and all elements of a legal prescription are present. So next thing I'm going to do is just take that off, throw that away. Okay, so I'm just going to show you a couple of things before I actually, get started. So this is the vial of heparin. It's labeled correctly. Okay, and for a subcutaneous shot, I would be using a 1 milliliter tuberculin safety syringe. It is a 28 gauge and 1/2 inch. So here's the needle. Okay, so I'm just going to apply hand sanitizer again, just in case. Okay. All right. So now what I'm going to do is I'm going to take an alcohol swab, open that up, throw that away, and I'm going to clean the vial, okay? So clean it really well, making sure I get into every crevice to prevent contamination. Okay, so place that to the side. All right, so now I'm going to open up my syringe, okay? Pull this out, set that to the side. So I'm going to uncap this, okay, and now I'm going to draw up 0.5 milliliters of air, and not touching the inside because I don't want to make it unsterile. Okay, so here is the 0.5 milliliters of air. Okay, perfect. So now I'm going to place this in here. Steady it. Okay, push the air in, and let it fall back. And I'm going to draw up 0.5 milliliters. Get all the air bubbles out. Okay, so now that I have that drawn up, I'm just going to place the safety syringe on. Okay, so here's the 5 milliliters of heparin. Okay, so I'm going to place that down. It's not contaminated because I have the safety syringe up. So this is where I perform my second check of medication administration of the 7 rights. So I'm going to create a label. So I'm going to write Jaguar J. Jones. So Jones, Jaguar J. K. MR 417-6352. 417-6352. Okay. Allergy to penicillin. Okay. Allergy to penicillin. So now I'm going to use this. So I have heparin, and I drew up heparin. Okay, so 5,000 units. This is 10,000 units per milliliter. So I would write 5,000 units per 0.5 milliliters. Okay, every subcutaneously. Okay, subcutaneously, sub-Q. Okay, every 12 hours. Every 12 hours. Okay. And the patient has not received it in the last 12 hours. Okay, so this is a high-risk medication, so I'd get a nurse to double-check everything behind me. So indication for this is the patient was in a motor vehicle accident, and heparin is given to prevent clot formation. So the last thing I would say is that all elements of a legal prescription are present with everything that I have. So here's my label. So I'm just gonna place that there. Okay, so now I have all of my information. Okay, I just want to make sure that I said this patient was not given not penicillin. Who's not given heparin in the last 12 hours per the MAR, and all elements of a legal prescription are present. So the next thing I would do is go to the patient's room. So I would grab all of my supplies. So grab my alcohol swab, my medication in the syringe, and the vial, and then the MAR. So I'm just going to bring the patient around here. Okay. So I'm going to set the MAR right here. This is my sharps container, by the way. Okay. And place the vial and stuff right here. Okay. So, knock knock. Hello, Mr. Jones. My name's Michaela Fry. I'm a student nurse at the University of South Alabama, and I'm here to give you your heparin shot. You were recently in a motor vehicle accident, so we're just giving heparin today because we don't want to have any clots formed, and heparin prevents clot formation. So, and you haven't received it in the past 12 hours. So I'm going to apply hand sanitizer before I touch the patient. Raise the head of the bed and make sure the patient's comfortable and everything. So the next thing that I'm going to do is I'm going to perform my third check of medication administration of the 7 rights. So first thing that I'm going to do. So I have Mr. Jaguar J. Jones on his wristband, Jaguar J. Jones on the syringe, and Jaguar J. Jones on the MAR. Okay, I have MR numbers 417-6352 on his armband. It's MR is 417-6352, and the MAR says 417-6352. Okay, So Mr. Jones is allergic to penicillin. It says penicillin on my label, and on the MAR it is patient is allergic to penicillin. So Mr. Jones, is there anything else that you're allergic to? No. Okay, perfect. So nothing else allergic to. So now I am just going to double check the medication that I have. So I have heparin, I have heparin, and I have heparin. Okay, so on the MAR it states that I give 5,000 units. I am giving, this is 10,000 units per milliliter, so that means that I would give 5,000 units per 0.5 milliliters, and I did write that 5,000 milliliters, or 5,000 units per 0.5 milliliters, and then it's given subcutaneously, and every 12 hours, and Mr. Jones has not received it in the past 12 hours, okay? So set that aside. This is a high-risk medication, so I'd get another nurse to double check everything behind me. Since Mr. Jones was in a motor vehicle accident recently with a closed head injury, we would give heparin to prevent clot formation, and all elements of a legal prescription are present. All right, Mr. Jones. So first thing that I'm gonna do, I'm just gonna use hand sanitizer again. Again, the patient is comfortable. Okay. And I am going to get my swab, my alcohol swab, throw that away. And I am just going to clean from the innermost to the outermost, making sure I don't go back over the cleanest areas. The heparin subcutaneous shot is given in the abdomen area. I should avoid 1.5 to 2 inches away from the umbilicus. Okay, so Mr. Jones, this might be a little cold. All right, so clean, clean, clean. Okay, so I'm just gonna leave this there to where I would actually, inject the heparin. So now I'm just going to apply my gloves, or my goggles, and then my gloves. Okay, so I have everything. Okay, so now, Mr. Jones, since I'm going to be given this shot in the abdomen, I'm going to squeeze. It looks like I can squeeze around 2 inches of skin. So that means I'm going to insert this at a 90-degree angle, okay? And heparin should be given 30 seconds for the whole injection. So let me know whenever you're ready. I'm ready. Okay, perfect. So let me squeeze the skin really quick, and I am going to count down for you, okay? So 1, 2, 3. Okay. I'm just going to slowly give this over 30 seconds, making sure the skin is squeezed. I don't know if that was 30 seconds. Okay, so now keep it squeezed. All right, Mr. Jones, how did you feel like you did? I'm gonna place this in my sharps container. Okay, how do you feel like you did, Mr. Jones? I feel like I did great. All right, perfect. So just gonna take my gloves off and throw those away. Okay. So, are you feeling any pain or tenderness? Is there anything else that I can get you? No. Okay, perfect. So, I'm just going to go back to the nurse's station and document everything that we just did, okay? I will be back in a few minutes to see how you're feeling with that heparin shot, okay? Okay. All right. See you in a few minutes, okay? Okay, perfect. So, now what I'm going to do is I am going to go to the nurse's station. I am going to apply hand sanitizer before I even leave the room, before I touch anything else, because I don't want to spread germs. So the next thing that I would do is come over to the MARS sheet. I would document. I would document the date, so it is 10/13/2025, okay? I would document the time. We're just going to say it's 23, okay? And my initials. I would also document that, you know, the patient, if the patient did well or anything like that, and the patient had no pain, no nothing, no pain. All right, so that concludes that. Mr. Jones is stable right now. I'm going to check on him in a few minutes. He's comfortable in his bed. I lowered the bed rails and raised them back up and, you know, lowered the bed to where he's comfortable again. And I documented everything, so everything should be good. I disposed of everything, and everything's in the trash. So that should complete my medication administration video. Thank you.